Hello, this is Dr. Krishnan. I'm a preventative cardiologist and the director of cardiac rehab. I'm excited to talk to you today about cardiac risk factors. So the title of this lecture is Risky Business: Controlling the Factors That Cause Heart Disease. So as you know, a heart attack can be called different names. Sometimes you'll hear it be referred to as a myocardial infarction or an MI. But the important thing to know is that this is a medical emergency, and if you've been through it before, you know that you need to seek help right away. It's something very serious and unfortunately is very common, and more than 600,000 people in America every year suffer a heart attack. So this is 1 in every 4 deaths. It's absolutely the number one killer of both men and women, and certainly our risk for heart attacks goes up with age. There's a slight preponderance towards men over women, but we know that by the time that women present, oftentimes we are much more advanced or much more serious because we have oftentimes atypical symptoms, which we'll get into that further. But it's just important to know that this is a serious condition, and every 34 seconds someone dies of a heart attack. And it's very common that if you've had one, if you don't do anything about it, you can have several recurrence. So what is a heart attack? A lot of you that know me and have met me in the office know that I use this analogy quite a bit, but I call it a plumbing problem. So we all have plumbing in our bodies, and the plumbing of the heart are the coronary arteries. So these arteries over time can build up plaque and build up. And some of this happens because of just life, genetic factors, things that we're going to talk about. But ultimately, if the plaque builds up so much so that it is blocking the blood flow through that pipe, that the heart muscle or the heart tissue doesn't get good blood flow, the heart will suffer. It's not getting energy, it's not getting blood, and ultimately it can die, or it suffers and it scars over. So that is what is a heart attack. And we'll talk about the symptoms of that. But if you experience symptoms or think you're having a heart attack or someone around you is, it's very important that you call 911 and you don't wait, because what we'll be talking about shortly is time is muscle. So here are a few pictures. The first picture, the more black and white image, shows the heart, and it really is kind of showing the structure of the heart, the different chambers and the blood flow. So the right side of the heart takes all the blood from the body, that's the blue blood or deoxygenated blood. It goes into the lungs and then ultimately gets oxygenated and goes out the red side. And so this is the heart pump. But if you look on the next picture on the right hand side, you can see the coronary arteries. This is the specific plumbing. These are the arteries that ultimately power the pump or the heart muscle. So you can see a picture there of the right coronary artery that actually feeds the back side of the heart, and the left coronary artery feeds the front side of the heart. You have another big branch called the circumflex artery that goes to the back and does the left to back side of the heart. Now, there are lots of other smaller branch arteries, but it's important to know these arteries, and if you've had a problem, where the blockage or the problem has been. The arteries are continuous, so oftentimes you will, if you do have plaque, there can be a little bit of plaque in many different places, but there are indications and reasons we choose to intervene depending on where it is and how much and so on. This is just another quick picture. This is actually nothing to do with the plumbing. This is the electrical system of the heart. So you can see the SA node that represented as a circle in that top right chamber of the heart. I call this the pacemaker, or your inherent conductor. This sets the electrical rhythm of the heart, and it moves through the AV node, which is like an insulator, down into the lower chambers of the heart. So this is the electrical system. It's just important to know about. There are lots of different electrical problems, but what is different about my analogy is if you're having a plumbing problem, what can be very lethal is if you're not getting good blood flow, you can get very dangerous electrical short circuits of the heart that can also happen, and that can take somebody's life as well. So again, symptoms to know about are really important. So if your heart is not getting good blood flow, if there is a blockage in your artery, oftentimes this is a deep chest pain. It is an ache or a pressure, and it can be anywhere in the chest. I mean, believe it or not, people can even have it more in the epigastric stomach area, but classically it's more to the center, to the left side of the chest, and it can radiate up into the jaw and face, down the arm, associated with some numbness and tingling. You can also feel very short of breath, nauseous, sweaty during a heart attack. If it truly is a heart attack, many patients say they've had a sense of doom. You don't have to be a medical person, but you know that something is wrong. And if you've ever felt this before, you don't ever forget it, and hopefully you'll never feel it again. But actually, if you block an artery again, it oftentimes comes with the same sensation or the same flavor. So it's important to know the signs and symptoms of a heart attack. And again, if you start to feel this chest discomfort, we say that every minute of delay means more and more damage could possibly be done to the heart. Because again, to mention, when the artery is supplying the blood flow there, if that part of the heart is not getting good blood flow because of a blockage, it basically hibernates. It goes into kind of a low battery mode until the blood flow comes back. So if we don't restore blood flow, and whether that's with a stent, with bypass, with medications, that heart muscle will eventually die and you'll get a scar there. And that's why people sometimes ultimately get weakening of the heart after they've had a heart attack. So we want to try to prevent having that. Now the term angina is really important, and angina can feel very similar to a heart attack, but basically there's no permanent heart damage. So we have intervened before there is actual scar or death of the tissue of the heart muscle. So it's different than a heart attack. And actually a lot of people who have had blockages, who've had heart attacks, who've had bypass surgery, can still have what we call stable angina, where they get some irritation of their arteries, but the plaque is not so built up that we need to actually do any procedures, and it can be treated with medicines. Oftentimes rest and nitroglycerin can help a lot, and actually it's why cardiac rehab can be very helpful, because we know that the heart is a muscle. It needs to be exercised and kind of re-strengthened again, and exercise, when it is monitored in a safe way, can really help people who have a lot of chronic angina. But again, just to talk further about the plumbing problems or coronary artery disease. So atherosclerosis or coronary artery disease, you'll also see it abbreviated ASCVD, means that you have plaque buildup in your arteries. If it happens in the arteries of the heart, we call this coronary artery disease. This is typically not something that happens overnight. Usually what we see is a very slowly progressive process where we start building up, you start having buildup of kind of cholesterol and soft fat. You get more and more deposits that then build up into plaque, and over time, with free radicals and inflammation, bleeding, lots of things going on here, it ends up ultimately calcifying and increasing the amount of plaque buildup. This causes gradual narrowing of the artery, and so once you get more than about 70% blockage, this can start to limit the blood flow to the heart. And we will see that really being limiting oftentimes when we exert ourselves, and this can cause what we call ischemia, which is the lack of blood flow to the heart muscle. So heart disease treatment options we've already kind of touched on, and again, if you're watching this video, you've probably heard of some of these and maybe even experienced them. But it's very important. So we have ways that we can open up these arteries if needed, and we can do that with bypass surgery if there's blockages in lots of different blood vessels. But oftentimes if there's just one blockage, then we can use a stent, or what's called percutaneous coronary intervention, or PCI. Usually alongside with whichever type of revascularization or whichever way we opened up the artery. Regardless, you'll need medications, but sometimes people also just only get medications as well. But it's usually a combination of medications and somehow opening up the arteries that will ultimately treat heart disease or coronary artery disease. But what's really, really important, and probably not stressed enough, is it's not just a pill that can fix this. It's not just a stent that will fix it, that you have to change your lifestyle. Usually, and this is what the focus of this talk is, the reason that you've built up plaque so aggressively and prematurely to such an extent is usually because of our lifestyle, and so we're going to talk more about that. But ultimately, we want you to understand that this is a three-legged stool, that it's going to be a combination of stents or bypass with medication, but self-care is really important. So we can do all of those things, and if you're not taking good care of yourself, the likelihood that that heart attack is going to come back again, and whether it's a blockage in the same place or another place, is very high if we don't make changes to our overall health. So what are some of the changes that need to be made? So there are different healthcare models out there, but we know that exercise with nutrition, stress management, and having social support is really important. And that's actually what makes cardiac rehab so successful. Risk factors that cannot be changed. There's nothing we can do about our age, and we know that as we get older, I mentioned that we have high risk of blocking our arteries. We know that there's some gender differences, that men oftentimes have blockages more than women, but certainly women's risk of stroke is actually higher than men. Family history, I tell this to patients every day. So many of us, we can't do anything about the cards we're dealt with, but there are so many things about our lifestyle that we can impact. So the risk factors that can be changed are smoking, our blood pressure, cholesterol, inactivity, diabetes, and kind of going along with almost all of these also our weight or obesity. And we're going to go into each one of these risk factors a little bit further. It's also very important to know that the mind-body connection is a real thing. We've actually done studies during, say, emergencies, say in New Orleans during Hurricane Katrina, and we're able to show that during high levels of stress, so whether that's the death of a loved one, an emergency like a hurricane, depression, all the things listed here, that people actually can get so upset about that this causes more inflammation in the body, and that certain plaque can actually rupture due to a stressor. So the plaque can actually rupture and become unstable and can lead to an actual heart attack. So it's really important to address psychological factors. Certainly we can't just completely get rid of all stress in our life, but too many of us deal with too much chronic stress that has to be better managed, whether that's with more social support, community support, reaching out to family and friends, getting an evaluation for depression or anxiety if that could be an issue, getting medication if that's what's needed, counseling if that's what's needed, but ultimately addressing the root cause of those things is going to be very important. So getting into smoking, this ties in very closely because we know that the majority of people who smoke are doing it to kind of fill a void. They have some type of anxiety, some type of issue that caused them to start, and now it becomes very hard to quit because it's an addiction. But it's the single most preventable cause of death in the United States. It's responsible for so many deaths. I know that we talk about smoking so much in terms of cancer, and most people know that if you smoke, it's bad for you and it causes cancer, but they do not realize that smoking is just absolutely terrible for the arteries. There are so many benefits of stopping, and that most people, in order to truly successfully quit for a lifetime, that you would have had to try more than 4 times. But there are lots of benefits. Some people have the impression that if they've smoked for 40 years, the damage is done, but that's just absolutely not true. There are so many benefits, and just 3 years after quitting, your risk of heart disease is almost the same as if you've never smoked. When we smoke, it can just be a very bad combination where the arteries become very irritable, they can spasm, it makes your blood pressure high, the list goes on. So oftentimes this risk factor is not to be taken lightly, and it does contribute significantly to blocking our arteries. So again, smoking harms us in so many different ways, but ultimately it damages the artery walls and promotes plaque buildup or atherosclerosis. It messes up your blood pressure, your cholesterol, and it encourages clot formation and dysfunction ultimately in how clotting happens. So we know that even reducing the amount that you smoke can be helpful. So what I really suggest, and I work with patients with smoking cessation all the time, is you have to be ready. You have to be ready, pick a time to stop, and then first just try to ration down. And so usually once you can ration down to less than 10 cigarettes a day, the withdrawal is going to be much less and it will be much easier for you to ultimately stop. It is very hard to just stop cold turkey, and it doesn't make you weak. It's because there's truly nicotine withdrawal symptoms that happen here. So oftentimes you're going to need a combination of medications, nicotine replacement therapy, and a lot of support to truly be able to stop and never pick up a cigarette again. High blood pressure. Okay, we all talk about this, hear about it every day. It is such a high risk factor for both heart attack and stroke. So we know that, again, millions and millions of Americans have high blood pressure, and when it gets high enough, we call this hypertension. But it oftentimes is the silent killer because, as I said, it leads to so many problems. The guidelines for blood pressures have ultimately changed, but what we know is that as close to 120 for the top number that you can get, the better. So really, on average, if the top number is less than 140, so 130s, 120s, that's acceptable. As soon as you start seeing consistent numbers of 140s, if you didn't already have a diagnosis of high blood pressure, if it's seen on multiple occasions of 140 or higher, the doctor will most likely talk to you, and if lifestyle changes don't work, then ultimately people are started on blood pressure medicines. We don't really have a safe range. I mean, we definitely know that blood pressures greater than 180 can cause acute stroke, acute heart attack, and cause chest pain, fluid buildup, all kinds of things. But it tends to truly be chronically high blood pressure of more than 140 or higher that's contributing to atherosclerosis, again, to blockages. And if you block arteries in your brain, that's a stroke. If you block them in your heart, that's a heart attack. And if you block them in your legs, that's called peripheral arterial disease. So now to segue into signs of stroke, as I just kind of mentioned. So stroke means that you're blocking arteries in your brain. And we have a little mnemonic here called FAST, which means people can have some asymmetry or kind of droopiness in their face. They can feel a weakness or heaviness in their arm. You might notice that they have some difficulty speaking, and that could be word finding or even slurred speech. And ultimately, time is brain. So this acronym is FAST. So it's really important that if you are experiencing these symptoms that you call 911, but even more importantly is if you notice someone around you, someone that you love, your coworker, that you call 911 for them. Oftentimes the person having the stroke is quite delayed realizing that there's something wrong. Because they are confused. But it's important to know that unlike a heart attack, a stroke is not painful. You will not typically have pain. You will just have this weakness, this numbness, the difficulty speaking, and this is very, very important that you seek help right away. There are other types of stroke, like a bleeding stroke, so I don't want to misguide you. A bleeding stroke can cause pain, but the most common type of stroke, which we call an ischemic stroke, where you're not getting good blood flow, this is actually a painless event, so it's why patients delay so much. They can go days without getting help. It's really important to know about cholesterol, and I know that all of you have probably talked about it. All of us should get our cholesterol checked at least once a year. But the goals for each individual person is different based on who you are. And I truly mean that. That means your age, your ethnicity, your chronic medical problems. Your doctor should give you a tailored, individualized goal. So if you're watching this today, most likely you have suffered a blockage somewhere. If you've blocked an artery in your brain and had a stroke or a TIA, if you've had a heart attack of any flavor, meaning you've had stents, you've had bypass, documented plaque in your arteries of your heart, or peripheral vascular disease, so arteries in your legs, that means you need to be on a cholesterol medication. It actually doesn't matter what your number is. Once you have documented plaque in arteries in the body, you have bought yourself a cholesterol pill. And what that does is not just bring your numbers down, because again, we don't know that there's an ultimate safe number. Like once you get your bad cholesterol less than 70, will you never have a heart attack again? It's more so that if you have plaque in the body, the cholesterol pills can actually stabilize any existing plaque, slow down the progress of it building up. And that's ultimately why most of our heart patients really are suggested to be on a cholesterol pill, and that's very specific to very particular pills at particular doses. Um, Ultimately, though, if you've been documented with coronary disease, we're usually more aggressive with your goal, and we really want to see it less than 70, and this is your LDL. And if you don't have coronary disease, in some other regards, a lot of patients' goals will tend to be less than 100, but this can be looser, again, based on each individual person's risk, which can and at times should be calculated. And doctors can do this, and we do this all the time, to decide when do we start these medications for people, when do we start them, how do we start them, what types of meds, and in what dose. We actually have lots of studies to explain how to do this. When you look at your cholesterol numbers, I know it can be very overwhelming, but just the same way I told you with blood pressure to focus just on that top number and just try to focus on having it less than 140, same with your cholesterol, I would just focus on the LDL. And your doctor will give you a goal. For most of you, that number is going to be less than 100, and it would be even better if it's less than 70. But ultimately, the LDL is the bad fat. You might hear them talk about the HDL, which is your good fat or your good cholesterol, and this one is a much harder to impact. Oftentimes we see this as being very low, and that's lower in men. It's lower genetically if you have born with certain genetic predisposition to this, and it is harder to impact, but ultimately actually lifestyle changes like diet and exercise are what impact the good cholesterol or HDL the best, just to tell you about it because I'm sure you've heard. But again, I would focus on LDL, and this is our target when we actually use medications. Now, again, a huge important factor is physical inactivity. This is a modifiable risk factor. So many patients, definitely patients over the age of 65, are sedentary. We just don't move around enough. But we know that any amount of exercise is better than nothing. There's some different recommendations out there, but we think at least 30 minutes of moderate intensity exercise 4 to 5 times a week can be so beneficial. Again, your heart is like a muscle. Just kind of keeping it strong, keeping the blood flow going can be so helpful. So even as simple as getting up and walking the dog every day. I mean, the dog would enjoy it and you would enjoy it. Going out with a walk with your family, maybe your grandkids or your wife. I always recommend stationary bikes because I love them. They're affordable. We can buy them used, park them in front of the TV, and you get on the bike 30 minutes a day. Just make it a part of your daily routine, and people can get a really great aerobic exercise. Some people find that if they join a group, so they get with a group of friends and they go for water aerobics or a yoga class, that can really help. But any kind of exercise, even if it was stretching, walking is better than nothing. This is just a saying, if exercise could be put in a pill, it would be the most widely prescribed medicine in the world. And this is just so true, that if there is one thing the heart doctor looks at is what can be most predictive of how long are you going to live, what is this person's prognosis or future, it is what is your functional status, how active is this person. So if you tell me that you can exercise 4 to 5 days a week on your treadmill or your bike, oftentimes we don't even need to do stress tests in these types of patients because they are doing stress tests every day on themselves and proving that their heart can work well. Diabetes, and we could spend all day on it, but ultimately it's not just about blood sugars. A lot of you probably have diabetes or at least are screened for it. Everybody, unfortunately, has someone in their family with it. But one of the most important things to know is while diabetes is so well detected and can be so well controlled, we don't have to have all the end organ effects of neuropathy and kidney disease and eye disease. But one thing diabetes can do, if you've had it for more than 5-10 years in particular, is it does lead to more aggressive and premature buildup of plaque in the arteries. So for us as heart doctors, we like to see your hemoglobin A1C at least less than 7, and we want to see your blood sugars under control because ultimately we're trying to lower your risk of heart disease. And if we've put in stents and put you on medicines for your heart disease, but your hemoglobin A1C is 12, your risk of heart attack is going to be very high. Diabetes very much relates to our weight and certainly our diet, but we know that diabetes can run in families. It's not every person with diabetes is not necessarily overweight. But we certainly know that the American diet does not help and has led to a lot of diabetes, a lot of sedentary lifestyle, and hence a lot of obesity. So many Americans are overweight, more than half of our population. The statistics on here are a little bit older. Um, Again, we are getting better at detecting and treating the diseases of obesity, but again, the vast majority of diseases that we deal with every day are caused by obesity. So ultimately, if somebody loses weight, their blood pressure gets better, their blood sugars get better, they are at less risk for heart disease and stroke, and this can also coincide with lowering their risk for certain types of cancers, less joint pain, and so on. So it goes hand in hand with the exercising. Again, we've already talked about the psychosocial factors for heart disease, but just to kind of throw in one more thing, because I think sleep, diet, exercise, all of that has so much to do with our stress management. But besides just blocking the arteries, there is another condition called broken heart syndrome, and maybe some of you have heard of it, where actually people can have weakening of the heart, just like a heart attack, but the arteries are actually not blocked. It's just from a surge of the stress hormones that can cause an acute weakening of the heart that mimics a heart attack. Thankfully, this is very rare, but it is a real thing, and so it's why this slide is in here twice, that I cannot stress the importance enough of dealing with our emotional health, not just our physical health, and how well these two are interconnected. And ultimately, if for most of us, if we get more active, we lose weight, we have a better diet, we sleep better, this oftentimes lowers the anxiety and stress levels for us. So again, here's that three-legged stool again about the medications, the surgery, and the self-care. So I'm going to end with this picture here, which I just love, and this comes from the newest prevention guidelines that just came out from the American Heart Association and the American College of Cardiology just in 2019, so it's fairly new. And ultimately, if you take anything home, it's remembering this picture. So we know that we can do so much to prevent heart disease. And if you've had heart disease, you can still use this as a guideline, as focusing on all of the parts of this wheel can really help prevent you from ever having a heart problem again. And so ultimately, when it comes to cholesterol, you have to work with your doctor to see what are your goals for your LDL, and if you need any further testing, and to determine whether or not you need a medication, which is most likely a statin medication. When it comes to high blood pressure, ultimately we want to see numbers, like I said, top numbers in the 120s, 130s. So here it's mentioned, 130 over 80 is the goal. Again, we can try to tailor goals to each individualized person, and this does change as we get older. But as just kind of a broad statement, for most people, keeping the blood pressure, the top number less than 140, will significantly lower your risk of blocking your arteries of coronary heart disease. Physical activity, again, we talked about it, so staying as active as possible. Any amount of activity is better than none. I'm going to kind of skip to the other side. Tobacco cessation, trying to stop smoking, and once you eventually stop, you can ultimately do so much in terms of preventing any further heart attack and making your risk the same as if you never smoked before. Diet, which goes, I think, hand in hand with so much of this on here. Diet and diabetes is really trying to emphasize more fresh fruits, fresh vegetables, nuts, whole grains. If you eat meat, choosing more fish and lean proteins like chicken, and trying to broil or steam or grill foods rather than fry foods or eating a lot of red meat, which is more inflammatory. So I know for a lot of people this is a real lifestyle change, but ultimately if you have diabetes, lots of these changes are very necessary anyways. And I find that when we learn to cook things that we like to eat and cook at home, this can really help us control blood pressure, diabetes, all of it together. There's lots of treatments out there for diabetes. If you have it, a lot of people are on metformin. That's a primary therapy. There's a lot of newer drugs out there now that have also been shown to be very helpful and may impact and slow the progression of ultimately getting heart disease. And then for lots of people, once the pancreas is not really working anymore, you need to be on insulin. And if that's the case, then doctors can tailor insulin regimens for you to make sure your blood sugars are well controlled. And then the last piece is the aspirin, which I know there's been a lot of questions out there about, do I need to take aspirin or not? And for patients who've had a stroke, whether that's a TIA or an actual stroke, we call TIA as a mini stroke, so a TIA or a CVA, if you've had a heart attack of any type, meaning if you've had stents or bypass, blockages, or blockages in the arteries of your leg, the answer is yes, you need to be taking a daily aspirin. Now, there are some exceptions to that based on some other kind of rare medical problems, bleeding problems, so you need to talk to your doctor, but the majority of patients who have known blockages in their arteries should be on an aspirin. It absolutely lowers your risk of having another event. For people who've never had a heart attack and stroke, we can determine if they benefit from an aspirin. And there are ways that we do this. It's oftentimes based on their other medical conditions, if they have high blood pressure and diabetes. But in the olden days, or when someone just turned 50 or 55 and they just started popping aspirin, we don't do that anymore. And that's what primary prevention means. Primary prevention means you've never had a heart attack, but we're trying to prevent you from having one. And so now it's reserved for select patients who are determined to have a higher risk, and so we do it from a prevention standpoint. But the vast majority of patients who are on aspirin should only be taking an enteric-coated baby aspirin of 81 milligrams. There's very few cardiac indications where we would ever give a full dose aspirin. If someone's having a heart attack, then yes, you will be given, oftentimes 325 milligrams of aspirin, but not on a daily basis because the risk of bleeding is high if you take more than 81 milligrams a day. So again, this talk was about the risk factors for coronary disease, the things that we can do to prevent ever having coronary disease, or if you've had it, basically how to prevent reinfarction or another heart attack or stroke. And there's lots of resources out there. There's almost too much information out there, but I always tell people to kind of focus on the big organizations like the American Heart Association, the American Stroke Association, and the Center for Disease Control puts a lot of information out there that can be very helpful. But of course, talking to your educators, to your providers, specifically your physician, and if you have a cardiologist about any of these questions, if any come up. But focusing on risk factors can ultimately prevent you from having a problem in the future. So I hope you found this talk helpful, and as I said, you can save your questions and feel free to ask them after, or save them for your doctor if you have any, and you can refer back to this PowerPoint if needed. All right, thank you.